It's an absolute juggernaut in the healthcare insurance industry. Let's dive into UnitedHealth Group and take a look. So I'm going to share my screen. I've got Gronk up here on the left, and I've got UnitedHealth Group, our analysis in the cash flow club. Revenues, $109.7 billion, grew $9.8 billion year over year. Now this is first quarter 2025, by the way. I don't think I mentioned that. But in the quarter, they had revenue of $109.6 billion. So that gives you the scale here of what we're actually dealing with. It's an absolute juggernaut in the healthcare insurance industry. A huge customer base that are all paying into an insurance platform largely through their employer. And employers don't change healthcare plans very, very often. I can promise you that as a CFO of companies myself, you stick with your healthcare plan, much like you stick with your 401k providers. It's not something that you really change on a yearly basis. You might change it every 5 years, maybe once a decade, if that. So incredibly sticky business model. They're saying costs are rising faster than they are able to pass them on to their customers. I can tell you from the health insurance plans that we received at our corporation, we received a 9% year-over-year increase in premiums. So they're definitely pushing it through to the patients. The question here, it sounds like the costs are coming in quicker than they thought, than that, in my case, the 9% that they passed through. Okay, fine. But that means next year they're going to make that up and push through some more premiums. The question is, someone still needs the health care. And even if the funding has been reduced, if you get sick, you still need to go to the doctor who's going to pay for it. You might have to come out of pocket more to compensate for that service, but you can't ignore the service. I think that's largely what's being missed here is the absolute stickiness of the need for healthcare.